Thank you very, very much for giving me an opportunity to share some of this work. I've given it a grand title as an evolving relationship between our faculty and HAIs in Kenya and Uganda, but it's very much a personal perspective of a novice in this space. For time, because of time, I will keep it as an overview of scope and ambition rather than providing any detailed information on what is going on or what is going to go, what the plans are. I come from a country which is torn by conflict for well over 30, 35 years. So therefore, post-conflict disability, whether it is in my own country or other countries where I go, is very, very close to me. And the question in my mind is, how can we in Manchester or Greater Manchester initiate and facilitate perhaps a South-South collaboration in low-cost, sustainable prosthetic limb service? That was a question that came to my mind when I visited Gulu, which is a city in northern Uganda, somewhere in 2010 or 2012, quite a few years ago. I think a historian looking back at the 20th and 21st century will record many events of great significance, technological advances, etc. But I think it is also reasonable to assume that conflicts between groups within a country will also dominate the landscape of the 20th and 21st century. Usually the picture is fairly common. What starts off as a fairly trivial dispute based on either real or perceived injustices are exploited by a variety of stakeholders, political, economic stakeholders, and it reaches a point where a large-scale military conflict is fought within a densely populated civilian area. And this pattern is recurring all over the global south. And the consequences of that is borne by people like this in the form of major disability, which is going to affect them for a long period of time. And these are some of the images from Sri Lanka, where I have done some work. And you have all heard about the war between the LRA and the government of Uganda, which is reported very, very heavily, leaving disabilities of this nature. And the question then arises, what is it that we do about it? What is the role of the diaspora? I emphasize the role of the diaspora because, at least in the Sri Lankan context, and I'm sure in many such similar contexts, the diaspora has perhaps played a facilitatory role in actually perpetuating some of these conflicts. So the diaspora has a special role in this. But do we have a constructive role? Can we play a role in rehabilitating some of the victims, maximizing the economic and social opportunities that are available to these people, and perhaps use the lived experience of the victims of these conflicts to perhaps prevent the recurrence of war? And coming from Sri Lanka, for me, this is perhaps the single most important issue when you talk about development. You can have all kinds of grand plans, but if communities within these countries start fighting with each other for whatever reason, all that is just a pipe dream. So I drew my inspiration from this man. He's called Dr. Panagamu. He's a rehabilitation consultant who works in the Midlands, who started work after the conflict finished in 2009 in a very, very humble ward in the northern province of Sri Lanka, rehabilitating and fitting artificial limbs to people, the thousands of people who lost limbs. And starting from these very, very, very humble beginnings with no government support whatsoever, no with a capital N, he managed to set up 2 state-of-the-art prosthetic limb clinics in the affected areas, supported by an outreach clinic which went out into the most remote parts of the country. So my Ugandan connections, at the time I was the head of years 3, 4, and 5 in the Manchester Medical School. My visit to Gulu was really to share some expertise in pedagogy between the Gulu Medical School and the University of Manchester and my medical school. And very soon it transpired, the consequences of the LRA war was everywhere to see in terms of physical disability, mental disability. It was everywhere to be seen. So it gave the question about how do we establish, evaluate a collaboration between Uganda and Sri Lanka, and perhaps involving GM, to advance a sustainable prosthetic limb service, which has benefited Sri Lanka immensely. Over a very short period of time, the Sri Lankan program managed to fit about 7,000 limbs because of the outreach services that were established there. For the project of these nature to be successful, it needs to be developed, informed, delivered, and evaluated by local stakeholders, as Diana has just mentioned. And this partnership was developed in partnership with Gulu Medical's faculty. This is Professor Morrow, who was the dean of the faculty at the time. And this is the head of the prosthetic medical school there. And we worked with some of the people who already had contacts in Gulu, and we started setting up this service. It was formulated by many stakeholder meetings that took place in such formal settings, and also very many informal settings across the rural parts of the province, of the city. So the different work streams were identified through these workshops. First of all, we wanted to establish the prevalence. What is the size of the problem? Can we establish a model of outreach limb services? Can we do a proper cost evaluation? Can we share the lived experiences of these disabled people and how culture and societal values and views affect the lived experience of these people? Because as you know, disability is experienced in the context of a given social cultural milieu. And perhaps in an optimistic note, and perhaps through my naivety, uh, bringing out the question, can we use the experience of these people who have gone through past conflicts to prevent future conflicts through a process of engagement? Because in my view, that to me is the single most important issue facing some of these countries, including the country I come from. So just talking briefly about the prevalence study, we did a cross-sectional survey of households supported by my colleague Jonathan Huck, who is a geographer here, who produced some very eminent GIS maps for us to identify random clusters across a huge geographical area, where we conducted semi-structured interviews with the household heads, and more detailed interviews for people who had lost limbs in those households. And this is the area that we were working across. It's a huge area of 8 districts of about 2.5 million people, 25,000 square meters. And these are all randomly selected points, each representing a cluster of 10 households where our teams went and visited to conduct these surveys. So I won't go into the details, but we were able to find a series of important findings. At least about 50% of the households had some form of major disability that was identified. We identified a significant number of people who had lost limbs, most of them in rural villages, which gives us a projection of roughly 12,000 people spread across that region, giving a prevalence rate of 0.6%. By the way, this is the first ever prevalence study of this nature done in relation to a conflict that was widely reported across the media at the time. We set up an outreach clinic, which is essentially that vehicle. The project was supported by the AHRC. In 2019, a total of 52 limbs were fitted using the outreach model. We also conducted a series of public engagement projects in partnership with a cultural organization which is based in Manchester, called In Place of War, but who have very, very extensive connections in Uganda. So they are local partners, an organization called Northern Uganda Hip Hop Group. They use street plays and traditional forms of Ugandan art to communicate some key messages, particularly in relation to domestic violence, workplace discrimination, and recurrent cycles of violence that happens in that part of the world. Which is very, very rewarding, because most of these engagement activities took place in market squares under mango trees like that. So that was the background to our Ugandan work. Our Kenyan connection started early this year with an MOU being signed between our faculty and the government of Kenya, which was in January 2020, just before the pandemic struck. The serendipitous, this MOU itself was in relation to comprehensive cancer care across Kenya. But the serendipitous opportunities and the contacts that we made during that visit and the signing of the MOU allowed us to, some of us, to interact with some key stakeholders when it came to their preventive actions around the COVID pandemic. So that gave us the opportunity to launch a pilot study to assess some of the barriers that exist in Kenya for implementing various public health bundles which are needed for the prevention of COVID-19. It could be masks, it could be hand washing, etc., in the informal settlements of Kenya. I mean, you can understand why informal settlements are important in this context. I wouldn't go into that, but that was the pilot study. It is a collaboration between several universities in Kenya, Nairobi, Kisii, Egerton, Kemri, University of Manchester. There is an NGO involved. And in the University of Manchester, all 3 faculties are involved in this collaboration. So the initial survey has been completed of 720 people were surveyed across 3 large informal settlements in Kisii, in Kibera, and in Nakuru. And I won't again go into the details. The details are still coming in. Of the 720, roughly 50% males and 50% females across all 3 settlements. Just to highlight an interesting observation which we made even at this very early stage. If you ask people through formal surveys, 90% of them say that they would use face masks whenever they go out. And the response is almost always they would claim that they would use face masks even in these informal settlements. But if you go to a random marketplace and take a photograph like that, this is by no means is this unusual. This is the norm. Very, very few people actually wear masks. So this comes to the point that Diana was making. There's a huge, in situations like this, there's a huge disconnect between what people report in formal surveys, etc., and what is actually happening on the ground. So it's worth exploring why and what does that mean for people like us who want to approach this from an academic point of view. And the future is we are currently working on an NIH application involving all 3 faculties, several universities in Kenya, Kemri. This is the relief agency that we work with because they have a long history of being operational in the ground in Kenya. The organization Diana was referring to, SDI, and of course APHRC. So we will see how many of these finally end up in the bid, but these are the organizations that we have made contact with, and the work is very much ongoing. And I'll like to finish and say thank you for the opportunity. It's a great privilege, and we will see how this space develops over the next few years. Thank you.